thank you very much. And as you heard, I have a little boy band intro, NSYNC, and so hopefully by the end of this talk, you get an idea of why I chose that. So we've already heard today about depression being a significant epidemic worldwide, and in fact, recent events, including COVID, have just really exacerbated the costs and the issues for individuals. We also heard earlier about one of the challenges in treating depression is that there's a significant fraction of individuals that are considered treatment resistant, meaning that conventional therapeutics such as psychotherapy and pharmaceuticals such as SSRI just don't work for them. And so in addition, I don't know which way I point this. Okay. Helen talked a bit about deep brain stimulation, DBS, as an invasive method for potentially treating individuals with treatment-resistant depression. But there are also non-invasive approaches that have been approved by the FDA, one of which is transcranial magnetic stimulation, or TMS for short. And in TMS, what happens is an individual goes into a doctor's office and a stimulation coil is placed over typically the front of their head, and they get around a 20 to 30 minute treatment of magnetic stimulation. So the idea is that there's a magnetic field that is produced that generates stimulation or currents in the brain, and those currents are all about remodeling the brain, entraining the brain, inducing plasticity, resetting networks in order to alleviate symptoms. So this is non-invasive. It doesn't require surgery like DBS, but if it works so well, why would anyone do DBS? Well, it turns out it doesn't work so well, or at least only about 30 to 40% of individuals actually respond to it, meaning that their symptoms are reduced by 50% or more. And so why is that? Why does it not work as well as, let's say, DBS? Well, it all has to do with the D in DBS, depth. Okay, so this is a figure here, which is a little bit misleading, and that's exactly why I took it, where you can see, once again, this stimulator is here, and you can see what looks like these magnetic waves going deep into the brain. And you might infer from this that these waves are directly stimulating these deep areas, but they're in fact not. TMS only really stimulates parts of the brain that are superficial, near the surface of the skull. So if that's the case, why does it work at all? So the way it works is basically hinges on the connectivity between parts of the brain where the stimulator is placed over and other parts of the brain that are the therapeutic target. So typically, the stimulator is placed over what's called the dorsolateral prefrontal cortex, part of the brain that's relatively superficial, but these areas that are the therapeutic target that we're trying to engage include what Helen already talked about, subgenual cingulate, the anterior cingulate, and there are all these connections, right, between the TMS target and the therapeutic target. Now, these connections, it turns out, are not static, and there's this notion of what's called functional connectivity in the brain, meaning that the strength of these connections changes potentially over time. And to illustrate this, I want to show a little video with these balls. And so imagine what I'm trying to do is put energy on this side and have the other side do something, right? So I'm basically trying to have these balls from one end to the other have energy displaced. Now what I did here, or what the person in the video did, is they actually generated essentially an acoustic wave. So they have these balls moving because it's in a dynamic environment. And in fact, what you're seeing with the result of this wave, which you cannot see, is the fact sometimes these balls are synchronized, meaning if we hit the ball at one end of the chain, the other ball would react. But at other times, they're unsynchronized. And so if we really want to put energy at one end of the chain, we want to do that when the balls are synchronized. So that's essentially the same thing that we're looking at in the brain, except instead of being bathed in an acoustic wave, the brain is based in electromagnetic waves or oscillations or rhythms. And so one prominent oscillation or rhythm is the alpha rhythm. And so what we looked to investigate was the timing in which TMS is applied at, let's say, this target site, that's where we apply the TMS, what is that relative to maximally engaging this therapeutic target? So at one time, you might have kind of small to moderate connectivity between the DLPFC and these therapeutic targets, meaning we can get some energy and drive these areas moderately. But if we stimulate it at another time, these functional connections would be much stronger, and therefore we could put energy in here and maximally stimulate what we have here. So given that, how would we do this? How would we actually build a system that allows us to do this? So we had to create a whole new type of instrument that we call a FET, which is basically a simultaneous fMRI EEG TMS system. I won't go into all the engineering challenges of building this thing, but needless to say, what we were able to do is track individuals' brain rhythms, determine the timing of that we should apply the TMS in order to maximally engage these deep networks that we're indirectly stimulating through these connections. And what was really important was the fact that we found not only are there preferred times or phases that we should apply these, the TMS, but that it was highly individualized. So different people had different times and different frequencies that we should apply the TMS in order to maximally engage the therapeutic networks. Given these parameters, what we could do is we could actually put this in a whole closed-loop system. This closed-loop system allows us to track over time the oscillations and deliver precisely during a therapy the TMS when it's specific to an individual to engage their targets. And so what we found in terms of a clinical study, so we ran a small clinical trial, and what was really exciting is we could double the response rate of individuals compared to conventional RTMS by going from around 40% to well over 80% by applying this synchronized treatment or therapy. In addition, what we found was there were biomarkers we could track over time that showed us essentially whether somebody was going to respond, and if they were not responding, how to dynamically retune the parameters so as to maximize the probability that they would be responders, that their clinical symptoms would alleviate by 50%. And so what this does is it kind of provides a whole new kind of dynamic, personalized approach to treatment, where the conventional approach with TMS is individual comes into a doctor's office, they sit down, they get that same treatment for 20 minutes to 30 minutes a day over a 6-week period, and typically at the end, one looks and sees essentially what happens in terms of their clinical symptoms. Now, in this highly personalized treatment, individual comes in, they get imaged with this new instrument that allows personalized parameters to determine exactly when stimuli should be delivered, at what frequency and what time, and that then gets dialed into a closed-loop system that then allows the individual to not just get that therapy, but to track their progress week by week and alter parameters in order to customize the delivery. So with all that, I wanted to also maybe go out to the 100,000-foot level and say a little bit about what does this mean. So beyond how this could affect, let's say, how we treat mental illness, things like depression, maybe schizophrenia, things of that nature, we can also think now realize that the brain is highly dynamic, and how different networks essentially are connected depends on time and these dynamics, and how we deliver stimuli to our brain. And this stimuli doesn't have to be just neurostimulation. It could be our sensory stimuli. That can actually be optimized in a way where in some, let's say, BrainMind in, 10, 20 years, these talks are delivered to you in a way that they're synchronized to the different parts of your brain that respond to attention or memory formation, and then maybe everybody really remembers these talks much better. And so I just want to end also by saying if you're interested in kind of these non-invasive methods that we've been developing to treat mental illness, and also there's a bunch of machine learning and AI, as people like to call it here. There are 2 students, PhD students, Zhao Sun and Chi Chang, who are volunteers here, and they would be more than happy also to talk to you over lunch or whenever. Thanks very much.